Cervical spondylotic myelopathy is a serious disorder where cervical discs can herniate and press on the spinal cord. It can give a constellation of symptoms, and it can be very subtle. One can not even know that they're experiencing these symptoms until quite late. It can be difficulty buttoning your shirt, dropping things from your hands, feeling a sense of heaviness in your legs, having difficulty urinating, or even passing bowel movements. You can have a patchy sensation of numbness that seems odd and doesn't seem to go away. It can be quite a debilitating disorder and frustrating if you don't have a diagnosis. These subtle symptoms should prompt an MRI of the neck, specifically what's called the C-spine. And once doing that, that would show these large herniated discs pressing on the spinal cord, which is actually causing spinal cord damage. We know of famous examples of cervical spinal cord damage, and these are very extreme examples that happen in trauma. Unfortunately, Christopher Reeves suffered such a trauma where bone pressed on the spinal cord, causing paralysis. Of course, this is an extreme example, and it's a traumatic example. What's happening in cervical spondylotic myelopathy is not sudden trauma, but slow onset of trauma of the disease pressing on the spinal cord. My job is to figure out whether what we see on the radiographs, that is, many times there can be reads saying spinal stenosis or mild crowding of the spinal cord, etc., that one cannot for sure correlate and the symptoms with the imaging. And that's what I would do in my office, and then explain the disorder and confirm the diagnosis. At that point, we would talk about treatment. Depending on the severity of the symptoms, if it's very mild with an occasional dropping from the hands, but you have a lot of systemic disease, we may even watch it and make sure that you're not getting worse. Do a trial of physical therapy. On the other hand, if you have severe symptoms of just unable to hold a spoon, unable to feed yourself, unable to really grip things, then we may want to take a more aggressive approach with cervical decompression. In this case, an arthroplasty, which is an artificial device that maintains motion, would not be an option. We would really consider an option of a cervical fusion, either from the front or from the back. This would refer to what's called an anterior cervical discectomy and fusion, which I talk about in my separate video, or a posterior cervical laminectomy with fusion. Even sometimes we do both because the spinal cord is actually being sandwiched from the front and the back, much like a sandwich, and therefore we have to decompress both the front and the back. The risks are, the benefits in most cases, by the time I propose surgery, outweigh the risks. By the time I think in my own mind that I feel that you need surgery, I've already calculated whether I feel that the benefits far outweigh the risks, and we would go through a careful discussion of what those risks are so that you finally make that decision.